talks by Professor Claus and Dr. Jacob. I'm here with a very, very simple subject. Lasers are very fascinating, and I think it is the future of medicine. We are using laser in a very small way in Zirona. To put it very simply, it opens the windows for fat to leave the cells so body can use it. Till the fat leaves the cells, whatever exercise we do, the body will not be able to use the fat. And I think it was a very illuminating talk, and my thanks to all the organizers who have given me an opportunity to come here and speak to you. The last time I spoke in Malaysia was around 20 years back. I had given a couple of lectures and training in cyclotron. And this style is a proof of that which belonged to the Malaysian Medical Association, presented to me around 20 years back. Thank you, thank you. It was a very colorful conference, that is why I put all the colors in the word conference, and let's move on. We all love stories. After all the high lectures, I'm going to come down to storytelling, which is very, very simple. There was a happy family. Everyone was happy in the family, everyone was enjoying. And suddenly, a villain comes into the lives of the family members. Now what happens? Some family members start feeling sluggish, out of sort, lethargic, then unexplained fatigue, frustration both physically and mentally, irritability, behavior problems, mood disorders, cognitive decline, memory problems start coming in. There's decreased mental ability, difficulty in concentration, and even seizures take place. Now what this villain does further, in some members it causes headache, vague nagging aches, joint pains, muscle pains, paresthesias. There's speech problem, language problem, you are hearing but difficult to understand, hearing loss. Some of the family members get high blood pressure, heart problem, stroke, vision problems, kidney problems, and this villain goes still further. It affects the digestion, pain abdomen, constipation, vomiting. Some patients lose weight, become anemic. It decreases the sperm count and decreases the quality of the sperms. There is reproduction problem, premature births, miscarriages, and the next generation is affected. There's low birth weight, there's slow growth, development delays, etc., and even cancer. Who is the invisible villain? It is a villain which has entered the body. It is a villain within. The toxic heavy metals. All these are features of one single heavy metal, that is the lead. Other than that, mercury and arsenic are the other common ones. And we also have nickel, cadmium, chromium, etc., which also are villains which are difficult to fight. A lot of our food are responsible for this. Toys which children play with, the industries, the transport. In transport, I'll put it this way, that there was a paper which I read in around 1994 or something, in which Punjab Agricultural University, they found that dogs were having lead poisoning. And the reason was, when dogs go out for a walk with their masters, their nose is at the level of the exhaust of the vehicles. Because in those days, almost all the petrol had lead in it. So dogs were getting the lead poisoning. Then agriculture, through the agriculture of food. So what does the millet do? It disrupts the cellular function, promotes inflammation, impairs the enzymes, damages the delicate lining of the blood vessels, causes plaque formation that contributes to atherosclerosis, heart disease, and where there is blood flow, plaques can take place, and blood flow is everywhere from head to toe. Like every story having a villain, there has to be a hero. We all remember James Bond movies. Every country has its own heroes in the movies. Amitabh Bachchan, James Bond. Comes, it disappears. The next comes, it disappears. There's something wrong somewhere. So I want to only go into things which have been there for a long time. Let's have a look inside the mechanism of detoxification. Irritate circulates throughout the body, throughout the bloodstream. It seeks the heavy metals. It's like a magnet which tries to attract the heavy metals. And it disrupts the bond between the heavy metal and the cellular protein. Once that is broken, it attaches itself to the heavy metal, lead in this case. It binds with that and takes it out of the body. To put it very simply, chelate is like a crab getting hold of the lead molecule and taking it out. When the heavy metal is removed, that's when the villain is killed by James Bond, things start improving in life. There's reduced pain, reduced inflammation, improved cellular function, improved enzyme functions, better oxygen delivery, and restored powerhouse that keeps you going in a healthier way. There are plenty of studies available. And all these studies show that chelation benefits. I won't go into the details. If anyone wants a copy of this presentation, which has all the details, he can simply email or WhatsApp me and get that. So I won't read out all this because it is available. So these are all the studies which are showing effectiveness. Mechanism, it removes the lead. It also removes the calcium. Previously we thought that it is clearing the arteries. And that is why in around 93, 94, we had coined this word, artery clearance therapy. Artery clearance therapy was coined by Civia Medical Center around 1994, which is the word which is now used almost worldwide. But now I think it is not clearing the arteries. It is more like inducing elasticity in the arteries, because elastic blood vessels can carry more blood than the stiff blood vessels. So we are no more calling it artery clearance therapy, we are saying artery chelation therapy, because I think that the clearing was a bit misleading. It improves the endothelial function and allows better blood flow. When there is better blood flow, there is better oxygenation, there is better nutrition, and it lowers the risk of various diseases, including heart disease, stroke, and potentially lowers blood pressure, taking a burden off the heart. I'll say potentially about blood pressure, because we have seen that more than 90% patients who have got heart problems, they benefit. But we have seen only about 40% patients who have hypertension, their medicines are decreased. And we are seeing around 10 to 20% patients whose diabetes medicines are decreasing. So my main thrust is on the heart problems or circulation problems that includes heart, the peripheral artery, erectile dysfunction. So when we got after the treatment, how does the patient feel? He feels less angina, less chest pain, less medicine needed, walk longer distance more comfortably, breathe easier, improve mental ability and memory. A patient is not interested in what is happening inside the body. His satisfaction is whether he is feeling better or not. So this is how a patient feels better and more satisfied. As far as the test is concerned, we have a wonderful test known as cardiovascular cartography. I believe there are around 4 or 5 cardiovascular cartography centers in Malaysia also. It's an absolutely non-invasive test. Takes around 28 minutes. Sensors are applied outside the body. And we get a lot of information. Some of the information is blood flow, renal blood flow. I'm saying blood flow, not blockages. It tells us about the oxygen, myocardial oxygen demand, supply and reserve, the stiffness in the arteries, the burden on the heart. Burden means that it distinguishes whether the burden on the heart is due to pressure overload, the volume overload or ischemia. So all three can cause angina and all three can have different treatments. This is what Dr. Linus Pauling, 2-time Nobel Prize awardee, he has said that chelation therapy has a rational scientific basis. EDTA helps reduce and prevent atherosclerotic plaques, thus improving blood flow to the heart and other organs. Like Dr. Lama, he said that he did not expect the result to be positive. Now, when research starts with this in mind, that the result will not be positive, our mind is working towards analysis in that direction. Trends in cardiovascular medicine, EDTA-based infusion, reduced cardiovascular events in post-MI patients. But EDTA chelation therapy goes far, far beyond heart disease. It detoxifies the whole body. Heart is more evident because chest pain is a very common feature, a very fearful feature, which is more evident when patient gets relief to feel both the need of the treatment and both to assess the result of the treatment. That's why most of the work has been done of EDTA chelation therapy on heart, whereas a lot of other things are also benefits are possible. Getting rid of that. Your brain function improves, cognitive functions, sharper memory, improved memory, better concentration, and benefits dementia. When I went to UK for training in chelation therapy, one of the patients I saw was his wife had got the patient on a wheelchair, and he had so much dementia that he did not know who he is, he did not know where he is, and she said when I leave him in the toilet, he doesn't know where he is. So that is the level. And she said, because when I was taking training, she had also started the treatment around that time only. She said she's able to see a bit of improvement. I don't know further treatment, how much it benefited the patient. Skin. I think one of the first things that is noticed by the associates, the friends, the family members of the patient, especially those who have not met him for a long time, is, what have you done? You are looking younger than before, your face is glowing. Here I correlate it with pink of health. We are saying pink of health, we don't say take any other color. When a person smiles, when a girl blushes, The beauty is because the circulation in the skin improves. Similarly with chelation therapy, the skin circulation improves and there is more beautification of the person. A person looks younger, he looks healthier, he looks happier. Chronic inflammation and pain almost all over the body are benefited. I will say it is the fountain of youth. Because we are as old as our arteries. We are as old as our circulation, decreases circulation. So when our circulation improves, the oxidation stress improves, cellular damage improves, their overall well-being. I can say that we can call it a very nice anti-aging therapy. It also benefits the cancer patients. I'll say especially in prevention. There was a study from Switzerland long back that those living in houses near the highway had more cancer than those living far away, probably related with the lead from the vehicles which was in the air. Immune system improves. Now there are few myths. One is that chelation therapy removes minerals from the body. No, it does not. It's a myth. I've been also thinking about it for a very long time. But ultimately, when we come to realize that EDTA is very selective, it's not going to get hold of everything. It is selective for calcium, it is selective for lead. So, getting rid of all, that gets rid of all the metals, all the essential minerals is wrong. Also, chelation therapy is not a one-time process. I always tell my patients that they should come for a follow-up every 3 months. Because we cannot change the atmosphere, we cannot change the pollution, that polluted food, we cannot change the way we are living. We are in a polluted world. And like we clean our house every day, we have to clean our bodies from time to time. Chelation therapy is quite a simple process, but needs to be done very carefully. By carefully, I mean your dose planning should be all right, your timing should be all right, the time of you give the infusion. Your patient selection should be very good. I am doing CCG test in every single patient before the treatment. I am doing the routine test in every single patient. And I am also doing echo in every single patient before the treatment. Another advantage I am having in CCG is it gives us an idea of the fluid level in our lungs. So if the fluid level is high, I can predict that this patient, if given fluid in excess, will go into left ventricular failure. So we reduce the volume of the carrier fluid accordingly. Similarly, if I have the slightest doubt that the patient may go into left ventricular failure, there is slightest doubt of fluid overload, I do an inferior vena cava study in every patient before every drip, wherever I doubt that he is predisposed to having LVF. And similarly, since the EDTA is to be excreted through the kidneys, a patient who has high creatinine level, I do not take up. Patients who have slightly elevated, I do a creatinine test before every drip. And routinely, even if the creatinine is normal, I do creatinine test every 5th IV session. The session normally takes around 3 hours, and after that also we keep on monitoring the patient. the more we know, the more we realize how little we know. And similarly is the story of Chelation therapy. We are far from knowing the whole story. We still do not know all the of Chelation therapy and not at the end of the road. So when you think of a villain, the heavy metal, always think of EDTA as the hero towards recovery. If you want to know more, you can always contact me. We have an online book, 100 questions that patients want to ask on Chelation therapy. If anyone wants to have that, he can email me or he can WhatsApp me. My email address is very, very simple. My name is Sivia, S-M-E-I-A. I am a doctor, so Dr. Sivia, the commonest email is Gmail. So Dr. Sivia @gmail.com. We are all here because in this conference, because we are actually different from the others. Most of us are daring to explore new treatments. And I love exploring new treatments, and I'm thankful to you, I'm grateful to you for giving me a patient hearing. Thank you from myself, and thank you from Team Sivia Medical Center. Any questions?
Any questions?
Yes.
This is a fantastic way of preventing cardiovascular diseases. This is a fantastic way of, managing and preventing cardiovascular diseases, various forms of cardiovascular diseases. I'm just wondering why most of the cardiac centers or advanced cardiac centers, they don't have chelation in their protocol.
Very, very interesting question. Have you got time?
Yeah, got it.
Yeah. I'll tell you how I went into it, and that will answer your question. In around 1991, a friend of mine who retired as Director of Health Services, his mother had a heart problem. Like anyone, she did not want to go in for stent, she did not want to go in for bypass. His sister, who was in UK, she sent some literature to him and said, Bhaiya, his brother, here this treatment is taking place, Chelation therapy, and can this be done on mama? She sent a lot of literature and he gave it to me. He said, Dr. Sivia, actually you are a medical man. You please go through it. He left it on my table. My first reaction was useless. And I didn't bother to read it for a number of days. So when someone says Chelation therapy is useless, I remember my days when I thought it is useless. My words were much worse, it is bullshit. Why even bother to read about it? Then one day, it was raining and I was free, there were no patients. I just turned the patient. One of them I saw, there was an article. In that article, there was a pre and post angiographic picture of a patient, pre and post Chelation therapy. I went through it and I said, there's something interesting. So the author's name was there. In those days, we did not have emails. So I sent a letter to him that can I have a complete article? That was just an abstract. So he sent me a complete article. I got interested. Then I was a young doctor that time, 90. I, being from India, that my friend sister also sent the directory of American College of Cardiology of Advancement in Medicine, people who are doing Chelation therapy. So I went through it. I noted all the names and addresses of doctors who seem to have Indian type of names. And I sent letters to them. And letters in those days are expensive. And my bank balance came down to around 0. Every doctor who replied He said, we are satisfied. Some said 90% success rate, some said 99% success rate. And two of them said, very good therapy, but don't start it. Don't start it because normal doctors are so much against this that your normal practice may be wiped out if you start this. You will have so much opposition from your own colleagues. So me and my wife, we thought, kya kare? It seemed a very, very attractive idea. Treating a patient without surgery, it seemed something you have to dream about. And two persons are saying who are successful not to do it. We have started kidney stone lithotripsy in 91. At that time, we were one of the first 200 centers in the world and I think third center in the country. And the only center north of Delhi. So we had monopoly and my patient had nowhere else to go. So my wife said, what's the worst that can happen? Lithotripsy patients cannot leave us. Even if they leave us, the worst is we have got a small piece of land, we'll go back to agriculture. That is where I started.
Excellent.
So we went through this. My first patient, in the meanwhile, one doctor from UK was coming to India, was doing chelation therapy. He gave me a crash course in chelation therapy before I went to UK and took more training. There was a relation of mine who had a heart problem. He was, at that time in Punjab, we had no angioplasty or angiography or bypass. I referred him to Delhi. Stent was put in. And after around 3 months, he again had angina. And he was told by the local cardiologist that you'll have to have another angiography, maybe a bypass only. So he told me, he said, Binder, that's my nickname. He said, Binder, till now I have not been able to repay the previous loan. How can I go in for a bypass? Do something. I had just read about chelation therapy. I had just taken a crash course in it. One of my cousins was coming from UK, so I told him to bring these medicines. And we started that. After a few drips, he started improving. Not only improving, his colleagues said that you are telling a lie that you have had a heart attack. From there, we kept on moving. Now, coming back to your question, I myself did not do it. How do you expect a person who has been trained 5 years MBBS, MD, DM, how do you expect him to believe in it? So I do not feel they are wrong. I feel that it is just the environment they have been brought up in, the training they have been given. That is one reason. Other reason is the commercial aspect.
Yes. So much of stenting, so much of surgeries, unnecessary surgeries can be prevented by this wonderful therapy.
If I'm adding to what you have said, leave aside chelation therapy. By cardiovascular cartography, where we are assessing the blood flow and not your blockages, we realize that most patients do not require bypass surgery. Because once your blood flow is okay, that means nature has already created your collaterals.
Right, bypass.
Nature has already created that bypass in the name of collaterals. Why are we treating? Yeah. In fact, I remember a very nice sentence from one of the leading cardiologists in India, Dr. Trehan. He told a patient, he said that a patient, when he showed his angiography, saw the angiography, he said, you have got 100% block. You are very lucky. You are lucky, you are alive, you are not having any major problem. That will God has already treated. And we do not require further treatment.
That's great.
So, I think treatment based on tests need not always be correct. We have to know how we are testing what the test is actually saying and how to interpret that test. For example, let's take the simple sake of lead. If we test the blood, we may get nothing in it, and yet the patient may be having lead toxicity. The lead may be in the organs and not in the blood. So unless you push that, give EDTA and all, push it out of the organs, it comes into the blood or into the urine, and then you test it, the test itself may be misleading. Similarly, when we think of angiographies, we are thinking of blockage, we are not thinking of blood flow. When we are thinking of blockage, we think the first thing that comes into our mind is stent or bypass. Where if you study the blood flow is decreased, then we want to improve the blood flow, not the blockage. And when we talk of blood flow, then chelation therapy, ECP, ESMR, lifestyle, all these come into the mind. So it is all how you, from what angle you are seeing it. If you are seeing heart disease from the angle of blockage, then stent or bypass. If you are seeing heart disease from the angle of blood flow, then it is ECP, ESMR, chelation therapy.
Thank you, sir.
Yeah.
Morning, Dr. Sibia.
Thank you.
When you do EDTA chelation, you open up the microcirculation. Is that correct?
Right.
Okay. How long does this microcirculation remain patent after chelation, and how many doses will you need to keep this microcirculation open?
I normally give 20 chelation therapy sessions if a patient is having ECP or ESMR with it. If it's only having chelation therapy, I prefer 30. And how long? It is like a patient comes to you. He has hit his finger with a hammer. He says, doctor, use a bandage. It is repaired. The wound is okay. How long will this okay remain? It will remain okay till it hits the hammer again. We are living in a polluted world. We are repeatedly exposing ourselves to the toxins. If you are repeatedly exposing ourselves to the toxins, you require maintenance tools like cleaning your house daily. So I try and give one session of EDTA every 2.5 to 3 months. Patients are coming from abroad. They cannot come every 2-3 months. So they normally come after a year and take 4-5 sessions.
You know, It is a beautiful presentation. Everybody is very amazed by your talk.
Thank you, sir.
And I'm convinced that cardiologists, they will be very happy because their money will be less.
No, I think every treatment has got its role. In case of emergency, there's nothing better than a primary angioplasty. There's nothing better than a bypass surgery when they are required. It is only when we are overusing a therapy, any therapy, even overusing chelation therapy, overusing ECP, overusing ESMR is wrong. Every therapy has got its own role.
Okay, thank you, sir. Beautiful presentation.